Welcome to Paint Another Picture, a medical educational play series. My name is Brenda Wilbert, and I am the playwright and producer of this series. I am also an artist, expressive arts facilitator, and former psychiatric nurse practitioner. I named this series Paint Another Picture because I believe if something isn't working, just paint another picture. My plays show the healing power of expressive arts for a variety of health conditions. Topics include, but are not limited to, depression, Alzheimer's, chronic pain, chemical sensitivity, Lyme disease, and heart disease in women. You will be viewing an episode on chronic pain. I chose this topic because we all experience pain in our lives, whether it's physical, emotional, spiritual, or a combination. Our thoughts have a profound impact on how we perceive pain in our bodies. Physical pain can often trigger emotional pain, and the body can store those memories. The opioid crisis in the U.S. revealed that we need to do a better job helping people manage their pain. Some individuals develop a substance misuse disorder after taking an opioid for acute pain following an injury or medical procedure. When the pain becomes chronic, a comprehensive pain management strategy and individualized plan are crucial. Medical schools curriculum often don't include adequate training in the management of pain. Sing Away Pain shows the healing power of expressive arts for chronic pain. It is one effective approach in an individual's pain management plan. Expressive art in any form of art can be used to express and release emotions. Engaging in the expressive arts has shown to have a profound effect on our immune system and stress response. In this episode, you will view a stage reading of Sing Away Pain, followed by a discussion with a healthcare provider. I like to end every episode with a poem. Expressive art includes poetry, and for some, reading or writing poetry can be very healing.
Scene 1. Time, present day. Place, a city on the East Coast. Setting, Cindy and Jay's living room. Jay is reading a book. The title in bold letters reads, Pain is not all in your head. Enter his wife, Cindy. She walks in, her manner conveying distress.
What's the matter?
The doctor riled me up.
What did he say?
I need a lifestyle overhaul.
A lifestyle overhaul?
I must learn to relax and slow down. Think about what I'm grateful for.
But he's treating you for pain.
He says my anxious personality is making everything worse.
Is that all?
How would he feel if he had to live with my pain all the time?
Did he imply the pain was only psychological? According to this book, some doctors do that.
No, he believes I have physical pain, but he thinks I'm focusing on it too much and tensing up my muscles.
What did he recommend?
An expressive arts therapist who's also a nurse practitioner. Apparently, I'm going to sing away my pain.
You going?
Well, I need to do something. Dr. Reynolds doesn't want to keep prescribing medications if they don't work.
Especially if one of your medications is an opioid. You don't want to get hooked.
I don't take it often. It makes me feel tired and depressed. But I need to find another way to manage my pain.
Did you ask him about our vacation?
No, he said absolutely not. If I can't walk without pain, a trip is out of the question. Unless you want to carry me up the hills of San Francisco. Let me see that book.
End of Scene 1. Scene 2. Time, the next day. Place, Cindy and Jay's living room. Jay is with his sister, April.
Where's Cindy?
Taking a short walk.
How's she feeling?
Oh, she's driving me crazy, complaining about pain day and night. She has me reading a book called Pain is Not All in Your Head. Pain may not be all in her head, but it's beginning to get into mine.
Cindy has always been so active.
According to the doctor, too active, not able to slow down.
Well, you like her energetic personality.
Sis, I love her bountiful energy, but lately she's not herself. Moping around. I miss old Cindy.
Cindy enters.
My back is killing me. Pain keeps spreading. It's in my legs now. I better sit down. Hi, April.
I'm sorry you're in so much pain. Are you able to see your clients?
I work fewer hours. Besides, it's hard to concentrate. Although, I'm seeing a new client tomorrow. Oh, my feet feel like they're on fire.
Can you go to dinner with us? April and I need to start planning Ma and Dad's anniversary party. We need your suggestions.
I can't go out tonight, but you go. I need to go lie down.
Cindy exits.
She's really suffering. Why don't you stay home and make her dinner?
I think I will. I don't know what to do. Her doctor recommends a practitioner.
Will she go?
I hope.
She doesn't easily accept help. Try to be more sympathetic. I'll call you later this week.
Okay.
Bye.
Bye.
April exits. Jay picks up his cell phone and calls the local bookstore.
Hello? I'm one of your regular customers. Do you have any books with coping with pain? Good, I'll be by tomorrow.
End of scene 2. Scene 3. Time, the next day. Place, Cindy's office.
How can I help you, Samantha?
Please call me Sam. Since my auto accident 3 years ago, I've been in pain. This has stopped me from pursuing my dream
Which is...
to be a singing clown.
Oh, why a singing clown?
I want to entertain people.
And what's your current line of work?
An accountant. I crunch numbers all day. It's so boring.
Any entertainment experience?
No. Which is why I can identify with singing sensation Susan Boyle. She's a shy person who followed her dreams.
And have you looked into clown school?
There's one I'm interested in, but it involves traveling. That's difficult because of my neck and back pain.
Was there permanent damage from the accident?
No, there's nothing more the doctors can do.
And if pain were not a factor, would you enroll in clown school?
I've always had some reason for not following my dream.
Are you saying that you might be using pain as an excuse?
I hate to admit it. I might be.
But you're here now. You ready to change? Okay. Can you commit to a plan?
I've allowed fear to rule my life for too long. I have to make some changes.
Well, your goal is to be a singing clown. Do you sing?
I sing for myself. I think I'm pretty good. I also write songs.
But you've never sung in public?
Too shy.
Well, I'd like to hear you sing.
Now?
It's an important first step to sing for another person.
That does make sense. All right, I'll sing a song I just wrote.
You ready?
I just want to be a clown to brighten up a rainy day. Be the one in town that makes the sadness fade away. No one would ever frown if I could be a clown.
It's great. How did it feel?
A relief, finally, to sing for someone.
Now, it's important to continue that momentum. How about singing for a friend?
I'll invite my friend Pamela over for dinner. I'll surprise her with a song.
And how's your pain now?
Not bothering me.
What do you make of that?
Maybe I can sing it away. I just want to be a clown, brighten up a rainy day.
End of scene 3. Scene 4. Time, that evening. Place, Cindy and Jay's living room. Jay is reading a book. The title in bold letters is Coping with Pain. Cindy enters and Jay looks up.
How was your day?
Hectic. Now that I'm the owner of the center, I miss the one-on-one personal training.
Can you fit it in?
Managing the athletes' training schedules takes more time than I anticipated. I'll have to see.
How's the book?
I just started it.
The topic must interest you.
It's hard seeing you in pain. I'm looking for answers. I want us to get back to the way we were before your injuries.
I don't.
What?
I had a light bulb moment today. It happened during a meeting with a client. My pain is a wake-up call for us to change our lives.
We were doing perfectly fine before your injuries,
We have been going at breakneck speed.
but we like to stay busy.
Why did we wait until our late 30s to get married?
What are you getting at?
We were always working. We didn't make time for relationships.
I thrive on being productive, and so do you.
And we continued this hectic pace after getting married. No wonder my feet gave out. Dr. Reynolds is right. I need to stop and take stock of my life.
I don't know what to say.
When's the last time that we had an intimate discussion about our goals and dreams?
What's there to discuss?
See, that's my point. We don't talk about anything of consequence. And the irony is I encourage my clients to communicate with their loved ones all the time. And I'm not doing it myself. I'm going to lie down.
End of Scene 4. Scene 5. Time. Several days later. Place. Cindy and Jay's living room. There are brochures on a nearby table. April picks them up.
I brought these restaurant brochures. We don't have much time to finalize plans. Our parents are expecting a grand party.
I'm not in the mood.
What's up?
It's Cindy.
Her pain worse?
No,
Then what?
she made an appointment with the practitioner.
That's great news. Why so glum?
She says our busy schedules are keeping us from examining our lives.
She's right.
Whose side are you on?
Well, she has a valid point.
Which is?
Well, you go non-stop to avoid self-reflection.
What's there to reflect on?
You avoid facing issues.
What are you talking about?
Well, let's take Cindy's health. Granted, you buy books on dealing with pain, but it doesn't affect your behavior. You're not sympathetic. Instead, you're frustrated when she complains, and you're angry the vacation was canceled.
I look forward to it. I'm not sure how to behave around her. She's always been independent, and now she's upset.
Well, why don't you talk to her?
I don't know how.
I have confidence you'll find the words. Remember, a crisis can be an opportunity for growth.
How did you get this wise?
Self-reflection and practice. So start practicing.
End of Scene 5. Scene 6. Time. 1 week later. Morning. Place. Joy Holder's office. Cindy and Joy are facing each other. Joy is holding 2 folders. On her jacket lapel is a button that says Sing. There is an easel with a large pad of paper. Next to the easel is a table. On it is a large box of crayons.
Dr. Reynolds referred you?
I saw him last week. I've been in a lot of pain. He said you'd be able to help me.
Well, now tell me about the pain.
I have burning pain in both feet. It hurts to walk. Oh, and my back and hips are always killing me.
Now, how long has this been going on?
A year. It started when I broke a bone in one foot, and a week later, I broke a bone in the other foot. Up until then, I'd been running 3 miles a day,
And what lessens the pain?
staying off my feet, but that's not my style.
Your style.
I'm always on the go.
The pain must have really slowed you down.
Oh, it has. I can't exercise. Oh, and concentration is very difficult.
Have you tried relaxation techniques? Like meditation?
No, but I've been reading a book on mindfulness that Dr. Reynolds recommended.
Oh, pain makes us tense up and it creates more pain. It's a cycle. Relaxation breaks the cycle.
I've been running my whole life.
From what?
My feelings.
See, often stressful feelings can create more pain in the body. With expressive art, feelings associated with pain or other events surface and are released. And this promotes healing.
Oh, I can't sing or draw.
No, it's not required. Let's try an exercise. I want you to relax your shoulders, get in a comfortable position, and now close your eyes. Now, take 3 long, slow, deep breaths. think about the pain you're experiencing. If the pain was an image, what would it look like? What shapes? What colors? When you see this image, open your eyes and draw it. Now, if nothing comes to you, that's fine. Choose colors and be patient. An image will emerge.
Cindy opens her eyes. She picks up 2 crayons, one red and one black. She starts drawing a large red ball with black arrows hitting the ball from all sides. After she completes the drawing, she places the crayons back in the box. She then gazes at the drawing for several moments.
If this image could speak, what would it say? I'd like you to write your response at the bottom of the drawing in large letters.
Cindy returns to the box of crayons and picks out a black one. On the bottom of the drawing, she writes, "I am arrows of hot, painful sadness." She places the black crayon back in the box.
What is this drawing telling you about your pain?
It's all wrapped up in sadness.
Tell me more.
My dad walked out when I was 8, and I never saw him again. I've probably kept super busy so I wouldn't feel the hurt.
And did it work?
I guess it did, but that's no way to live. I need to face the music. I'm tired of running. Ironically, I can't physically run anymore.
Powerful emotions often emerge with expressive art exercises, so it's not surprising that your physical pain brings up these emotional issues. How is your pain right now?
Not hurting as much.
It's going to take time, but I can help you replace the stressful images with positive, healing images.
I'll be back. I'm glad I didn't have to sing today.
Well, maybe next time. Now, why don't you take this drawing with you? And I'd like you to try a few exercises before we meet again. Here, they're in this folder.
End of Scene 6. Scene 7. Time, 1 month later. Place, Cindy and Jay's living room. On a table next to Cindy are a box of crayons, a folder, and the drawing from her meeting with Joy. The drawing is rolled up with an elastic band around it. Cindy is drawing on a sketch pad. Enter Jay.
What are you doing?
Joy gave me some exercises. I'm drawing my feelings.
Since you've been seeing Joy, you seem more relaxed.
Oh, I am. Between the expressive arts and the pain management strategies, I'm feeling more hopeful.
Can I see your drawings?
Let me show you the first one.
She removes the elastic band and shows him the drawing. He studies it.
The pain must really be bothering you.
Oh, more than you know. Now let me show you the next one.
She removes a picture from her sketch pad and shows it to him. It's the side view of a person carrying over her shoulder a large bag of rocks. The rocks, in bold letters, say anger, sadness, and fear.
I've been carrying around this bag for years, ever since my father left.
I know very little about him and what happened.
It's just been too painful to talk about.
Tell me now.
You sure?
I've been thinking about what you said. We don't take the time to share what's important.
I avoid intimate discussions too.
So what happened to your father?
Oh, I just adored him. He was so lively and charming. Oh, he loved to dance. Oh, and listen to music. My mother, she was the serious one. But he couldn't hold down a job, and they were always fighting about money. I think he may have had a gambling problem. I will never forget the day that he left. He brought his suitcases downstairs, and when I asked him where he was going, he just said, "I love you, my little darling." And he got in his car and he drove off. That was the last time I saw him. I mean, my mother told me that he didn't want the responsibility of a family. There may have been other women, but she refused to talk about him after that. It was just the two of us from then on. The music stopped that day.
Ever try to contact him?
No, I always wondered if it was something I had done to make him leave. I was just a child. Joy said that physical pain often brings up emotional pain. Who knows, maybe my back pain will get better when I stop dragging around all this old baggage.
I'm sorry you had to go through so much as a child. Let's go upstairs. I'll massage your feet.
Oh, I'd love it.
Cindy gives him a hug and they exit. End of scene 7. Scene 8. Time, several days later. Place, Cindy's office. Cindy is awaiting her next client. Enter Sam, wearing a colorful blouse and a clown's nose.
Well, someone is getting into character.
Dreaming of clowns day and night.
Did you sing for your friend?
Pamela couldn't believe her ears. I told her I wanted to be a singing clown. She said, "You would choose that over accounting." We both laughed.
And how's the pain?
Better.
What's made the difference?
Singing helps. Also, meditating twice a day. My body is beginning to relax. Since seeing you, I realized I need to make some mental adjustments, not just physical ones.
Good. What adjustments?
Accepting pain, staying calm when I have it, and not expecting to enter clown school without bringing my physical challenges with me.
New revelations?
I expected to function at the same level before I had pain. Not anymore.
Good. Now, pain can be a gift if it opens you up to new ways of being.
I'm learning that.
Now, what's your next move?
I've made an appointment with the director of the clown school. I'm having a small party at my house. I intend to greet my guests with a song.
Well, you're definitely on the road. Now, a good way to stay focused on your dreams is to create a vision board.
What's that?
Well, get yourself a large white foam board and a bunch of magazines. Think about what you want out of life and make a visual representation on that board. Now you can cut out pictures and sayings. Look at your board each day. That infuses your dreams with positive energy.
Thanks for all of your help. A song for the road?
Oh, I'd love it.
I want to be big. I want to be bold. I want to spread my wings before I'm too old. Kick out the pain. Start the show. I want to entertain. Here I go.
End of scene 8. Scene 9. Time, 1 month later. Place, Joy's office. Joy is watching Cindy, who is standing next to the easel. On the easel is the drawing of her carrying the bag of rocks. A nearby table holds a box of crayons.
All these feelings have weighed me down for so long. It's time to let go.
Now, let's try it again. We'll close your eyes. Take a deep breath in and count to 4 as you exhale. Think about your drawing. Now ask your body to present you with a positive healing image that will replace this drawing. And when you see this image, open your eyes and draw it.
Cindy opens her eyes and goes to the easel. She takes down the drawing and places it on the table. She draws a person whose face has a big smile. The figure is looking down at a large heart in the middle of her chest. In this heart, in bold letters, are the words love, sadness, joy, hurt, acceptance, fear, and hope.
If this drawing could speak, what would it say about your life lesson?
To love and to accept all my feelings, even the painful ones.
And how do you feel?
Lighter.
And how has your pain been?
Better. Now, massage and acupuncture have helped, and I've been practicing mindfulness techniques. I express my feelings through images in my journal. I still have pain, but I'm no longer fighting it. That makes a huge difference.
I would like to teach you a technique that's called toning. Okay? Your voice is used to express sound for the purpose of relief and release. Whenever you feel pain, bring your attention there and then consciously breathe into it. And as you exhale, release the tension from that part of your body. Give a sound to your feeling. Continue making sounds until you feel the release. Okay? Now let's try it.
Cindy closes her eyes and starts humming softly. The tone becomes louder. She goes for about a minute, then opens her eyes.
I feel relaxed, more present in my body.
Okay. Continue the imaging exercises and add the toning.
I will. Thank you for all your help.
Now, before we end, let's sing a song. Singing is a great way to increase energy flow.
Maybe I can sing my pain away.
Well, it's been done. I'll sing the song first, and then we'll sing it together. Okay? All right. Flow, flow, go with the flow. Art allows our spirit to grow. Shine, shine, let our light shine. Time to release pain from our mind. Okay? Now let's sing it together. All right. Okay. Flow, flow, go with the flow. Art allows our spirit to grow. Shine, shine, let our light shine. Time to release pain from our mind. Let your light shine.
They hug and Cindy exits. End of scene 9. Scene 10. Time, 2 months later. Place, Cindy and Jay's living room. Cindy is reading a book entitled Expressive Arts for Couples. There is an easel with a large blank paper. A table nearby holds crayons. Enter Jay.
How was your day?
Hey, I saw a few clients and worked on my vision board. And as I visualized my hopes and dreams, it occurred to me I wasn't including ours. We need to do that together.
Are you getting any ideas from the book?
Oh, I am. There's an exercise to get us started. How about doing it now?
Why not?
Do you want me to go first?
Yeah, sounds great.
All right, here. Now, read the first paragraph at page 45. The bookmark is here. And would you move your chair away from the easel so you won't see mine?
Jay moves as Cindy stands by the easel. Jay picks up the book and begins reading.
Close your eyes. Think about the relationship you want with your partner. Imagine it as a color, shape, or symbol. When you can see the image in your mind, open your eyes and draw it.
Cindy opens her eyes. She selects a red crayon from the box and draws 2 large hearts. The hearts are connected by a thick red string. On top of the string are 3 musical notes.
It says, name your drawing.
Cindy writes on the bottom of the page, I hear the music of our hearts. She turns her drawing over, replaces the crayon in the box, and goes over to Jay.
Your turn.
Jay hands Cindy the book. He takes his place by the easel. Cindy begins reading.
Close your eyes. Think about the relationship you want with your partner. Imagine it as a color, shape, or symbol. When you can see the image in your mind, open your eyes and draw it.
Jay opens his eyes, selects a black crayon, and draws 2 heads with their faces touching. He writes on the bottom of the page, dancing cheek to cheek. He replaces the crayons in the box and faces Cindy.
I'm finished. I named my drawing. Come here, let me show you. I imagine us dancing cheek to cheek. We've only danced at our wedding. Bring on the music.
Cindy turns over his drawing and reveals hers.
I want our hearts connected, and I hear the music again.
He goes to Cindy with his arms extended.
May I have this dance?
Cindy goes into his arms. As they dance, Jay begins singing.
Thanks to heaven, now I pray, singing takes your pain away.
Thanks to heaven, now I pray, singing takes my pain away.
Thanks to heaven, now we pray, singing takes our pain away.
Let's have heavenly dreams.
They exit hand in hand. The end.
I would like to introduce Amy Coombs. She's a nurse practitioner and founder and owner of Whole Life Healthcare in Newington, New Hampshire. Welcome, Amy.
Well, thank you for having me. I think it's really great. The play really brings a wonderful awareness to the issues around chronic pain and giving people more tools in their toolbox to take care of that.
Great. Well, Whole Life Healthcare is an integrative practice. Can you explain to the audience and viewer what is an integrative practice?
So integrative medicine is a combination of Eastern and Western medicine. So it's really the best of both worlds. We are able to prescribe medicine, do diagnostic testing, at the same time look at all the other areas such as massage or energy work, chiropractic, that is able to give people a better balance in their life.
What types of chronic pain patients do you see in your practice?
We see all types of chronic pain. We do fibromyalgia, chronic back pain, chronic abdominal pain, headaches. All of these are different types of pain, plus many more.
Well, can you maybe give a patient example and maybe speak to the issue of how you approached your patient in an integrative way?
Certainly. So we do an approach by just getting to know the person first and listening to what they have to say, looking at their history, finding out what they've tried, what they haven't tried. Then we go ahead and develop an individual care plan looking at what conventional medicines need to be done, what kind of diagnostics need to be done, and what can the patient afford or believe, what do they believe in order to balance themselves. It's really about balancing mind, body, and spirit.
When you talk about believing, what do you mean by that?
Well, I think medicine and healing is 80% belief.
Yeah.
So if you have somebody who doesn't believe in medication, a medication's not going to work for them. If somebody doesn't believe in Reiki, it's not going to work for them. So you have to have somebody who can believe in what they're doing, and some of that is achieved just through education. I think from the beginning of my practice until now, many of the people who have come to see me were very conventional and now are doing some alternative therapies within their own healing. So it is just a matter of time and getting people to understand what they can do to help their body balance.
What is the definition of chronic pain?
So chronic pain traditionally is defined as pain that exists for greater than 3 months.
And is pain, we're talking about physical, emotional, spiritual, what are we?
We're talking about all of those. I mean, emotional trauma can trigger pain. Pain of back pain can trigger emotional trauma. So it's really a little bit of everything, and they all interact with each other.
When people in chronic pain, they often get caught up in a pain cycle. Can you kind of explain what that is?
Well, the nervous system has 2 branches. The sympathetic, which is really the accelerator. When your sympathetic nervous system is stimulated, you have an increased heart rate, muscle tension, and increased blood pressure. And then there's the parasympathetic, which is really the brakes. It is, well, if I can back up, the sympathetic really is that fight or flight. When somebody is stressed, their body reacts. The parasympathetic is really the brakes for that. It is how people restore, relax, and we have to have both of those in balance in order to achieve any kind of optimal health.
So the pain cycle is the parasympathetic and sympathetic, is that what it is?
Yeah, it's a combination, and really sometimes trauma can trigger an overload on the sympathetic nervous system, and so you get muscle tension, and you have an increase in pain when someone is having a lot of pain, a lot of emotional stress just because
Yeah.
of the pain.
So I see that too as a cycle where they're upset about something, they tighten up their muscles, that creates more pain. Then they get upset because their muscles are tightened, and it just goes in that way.
It certainly does.
Yes.
And I think there's emotional pain. Someone can have chronic back pain, but then they have a death in the family or a child that's acting out, and that really worsens their pain as well. So it really is very interconnected.
Well, if somebody is like stuck in a pain cycle, how do you interfere with that?
We really start by kind of, it's like an onion, peeling back the layers. We start by just listening to them and finding out what their journey has been. What have they tried? What have they not tried? What was the original injury? How did it all begin? And many times when you dig deep, it is really about some trauma that happened many years ago. So then
Does the body like store memories? Or?
Absolutely. Yes.
Can you talk more about that?
Well, there's two, there's the conscious mind and the subconscious mind, and many traumas, people compartmentalize and they sort of bury them in that subconscious mind. And as time goes on, those things can creep up and come right back in your present memory.
That's it.
And that can trigger some muscle tension and trauma, re-traumatizing somebody.
Well, what I was wondering about is, in terms of healthcare now, there's such a mind-body connection. I think we've been talking
Absolutely.
about that.
Yes.
And so how does our thoughts influence our health and the pain we experience?
Well, I think if you can have positivity and you can think, and I do this a lot with my patients, many times pain creates a really negative cycle in someone's psyche. And so if you can get them to just start thinking about 3 positive things in their life, and they have it as a mantra every day, that really starts, and again, we're talking about just sort of balancing the sympathetic and the parasympathetic, kind of slowing down, taking a breath, and getting them to really change how they think about their situation, and really trying to give them some hope by really listening and trying to figure out what kind of individual plan we can have them with. There's not one set plan for every single person, so you have to kind of look at what somebody is willing and able to do in order to develop the best plan for them.
And I know that one time I was really experiencing some chronic pain. And I was telling my husband about it. I was complaining. I said, it's just hurting me so much. He said, go up and do your art. And, as we talked about in the play, if you access, release, and transform your emotions, it can be very calming. And it really activates the right side of your brain, which is the relaxation part, the being present. And I just got out, and that's kind of like breaking my pain cycle at that point. So it really helped a lot. And so it's distraction, other kinds of things that could help.
Yes, I think, even just visualization, having somebody go to a place that is peaceful and relaxing for them. Many people like listening to the beach or going to a time when it was very happy in their life and they can go back to that. Accompanying that with breathing or some sort of distraction therapy is very helpful because it kind of reroutes your thought process. And again, we're going back to that positivity and getting our life back on track.
I also, as a visual person, I imagine each person having a pain management chest. And they continually add to this chest and pull out what they need at a particular time. For instance, if I'm in pain, I may go to a massage and say, that will help me at this particular point. So I would like to know what would go in a pain management chest? I mean, what kinds of things would you think about that you've noticed that has helped patients with chronic pain?
Well, I think there's so many things. And again, you have to look to that individual and what they're able to do. Take a fibromyalgia patient, for instance. They're very sensitive to touch. Fibromyalgia is a soft tissue arthritis, very sensitive to touch. Massage would not be a good choice for them.
That's right, yeah.
But energy work would be good for them. Bowen's is a type of energy work out of Australia, or Reiki, or cranial sacral.
What is energy work?
It's working with the energy field around the body, and it's complex, but it's amazing how well that works. Our Bowen's practitioners, a lot of people with chronic headaches, have had concussions in the past.
Okay.
And there's Bowen's is works on the nerve and tendon insertion sites, and they release post-concussion syndrome and headaches resolve. Wow. It's pretty amazing. And in Australia, they have these type of practitioners right on the athletic fields that release that concussion as they happen, so they don't get post-concussion.
And
chronic
Reiki
headaches.
is similar to that? Or?
Reiki is similar. It works with the energy field around the body. We all have a magnetic field around us, and they work on balancing that. Craniosacral is working on balancing the top and the bottom of the spine, the cranium and the sacrum, and it's very powerful in what they can bring out and what people, that stored energy, that stored memory, they really bring those things out when they work on somebody. And we have both Reiki and craniosacral, and they do co-treating at times. They'll be in the room at the same time with a person. If those practitioners feel like that is the best thing for somebody, they will co-treat at the same time.
Great. No, Amy, you've really given us a lot to think about today. Is there anything you'd like to say before we end?
Well, I think that with chronic pain, it is less about medication, it's about balancing your life. Really looking at where does it come from, what do you have control over? Many times we don't have control over pain, but we do have control over what we eat, how we sleep, how our stresses are in the life. And I have my patients address what stress is going on in your life that you can minimize. So we work on what they can control, and then we try to get some conventional medicine going to figure out what we can change so their pain goes away. But it's really a balance and working on just getting people to be more aware of what's going on in their bodies.
Great. Thank you so much, Amy.
You're welcome.
I recommend the book Art and Healing by Barbara Gannon. Barbara was one of my teachers at the Expressive Arts Facilitator program at Salve Regina University in Newport, Rhode Island. Barbara discusses in her book how painful, unexpressed emotions and negative thoughts can cause immune system dysfunction and cellular malfunction, resulting in illness and disease. This is the stress equation. To release stress, we must deactivate the stress response by releasing negative thoughts and stress-producing emotions. Through art, the body releases these emotions from the body, deactivating the stress response and inducing the relaxation response. The 3 stages of healing, according to Barbara Gannon, are access the stress-producing emotion or a negative thought through body-centered awareness and visualization. Release the image through drawing, painting, clay, movement, sound, or writing. Transform the stress-producing image into a new image that represents a less stressful, more positive, and constructive way of responding to a difficult or painful issue or experience. In the play Sing Away Pain, Cindy accessed, released, and transformed her emotions through visual journaling. She recognized the emotional component of her chronic pain and some of the issues that were holding her back. The book Art and Healing contains exercises and instructions on how to set up a visual journaling practice. You can start this expressive arts journey at home. I would like to close by reading the poem Hope, written by New Hampshire poet Sarah Matthews. I am never empty-hearted. I always have at least a hint of hope, and sometimes when it seems to have gone missing, I'll find a wisp like smoke that hovers, there for just a little prayer to fan it into the flame.